Every athlete that reports to Quinnipiac to play a sport here, they go through a screening process. It's pretty multifaceted, and one of the parts is concussion baseline assessment. So we take them through our concussion baseline, which again consists of numerous different tests. So therefore, we kind of know how their brain functions when it's healthy prior to any kind of insult or injury.
Well, as part of their pre-participation examination, and every year our athletes are required to fill out a health history questionnaire. So our incoming freshmen have filled out a detailed health history for us to review. And if something appears on that health history, head injury related, we'll ask for possibly some additional documentation just to make sure that they were evaluated by a physician at home, and maybe what was done for them there, just so that we have the history is included in our treatment plan as well.
Most, we're removing them from their sport if it's during a practice or a game. If it's after the fact, then they're coming into the athletic training room. Again, our steps are the same. We're going to assess them. Our first concern is any kind of serious life-threatening injury, so we're going to rule out any kind of a brain bleed, any type of a C-spine injury. And once we kind of ruled those to be, not applicable or not the case, then we'll go ahead and go through our normal concussion assessment. So we test things like cranial nerves to make sure, again, that they're intact, and again, that's to help rule out any kind of a brain bleed as well. And then we ask them different things, orientation questions, simple processing questions. We ask them to recall what happened to them, certain things, basic things like what's the date today, the month, things of that nature.
Those people day to day to watch to make sure and see how long it takes for their symptoms to resolve, and to make sure that they're going in the forward direction and not backwards. And at any point that we think, either initially that some of those life-threatening things are an issue, then we have our physicians that we can refer to, or we have obviously emergency departments and stuff like that too.